מתכבד עתה להציג את הרצאת המפתח של הכנס שתינתן על ידי זוכת פרס הרמב"ם השנה, פרופ' אליזבת נייבל, בנושא חזרה לעתיד הרפואה, Back to the Future of Medicine. And now I'm going to revert to English. 4 years have passed since I stood here on the same podium on the occasion of the 2014 Rambam Summit, presenting Professor Elisabeth נייבל to deliver a keynote lecture as a guest of the Rambam Summit, one of several visits to Israel and Rambam in recent years. Professor נייבל now returns as the 2018 80th year of Rambam, 70th year of Israel, Rambam Award recipient. She prefers to be called Dr. נייבל, or better still, and for me always, my dear friend Betsy. As I said then, and reiterate now, I had the privilege of sharing with Betsy formative training years in Boston, after which I followed Betsy's meteoric career development with admiration and awe, while staying in touch, as Betsy's always willing and able to generously share her time and enormous talent. This is how she was as a medical intern at the Brigham and Women's Hospital, and continues in this spirit of caring and generosity to this day as president. But first things first, for those who were not present at the 2014 summit, allow me to officially introduce Dr. Elisabeth נייבל. She's a cardiologist and distinguished biomedical researcher, professor of medicine at Harvard Medical School, and since 2010, president of Brigham and Women's Hospital in Boston, now Brigham Health. Betsy received her MD degree in '81 from Cornell, with 5 scholarship prizes, followed by internal medicine and cardiology training at the Brigham. During her residency, she met Gary, then an intern, now her husband of more than 30 years. Gary is chief scientific officer and in the executive leadership of the pharma giant Sanofi. Betsy and Gary's 3 children have all pursued medical careers, MD, PhDs. Whether this is nature, nurture, or genes and environment, obviously they're all interacting. Gary is here, not this morning, but he's here as part of the visit, and we welcome him as well. In 1987, Betsy was appointed as assistant professor of medicine at the University of Michigan and rose through the ranks, becoming director of the Cardiovascular Research Center, professor of medicine and physiology, and then chief of the division of cardiology in '97. While at the University of Michigan, she became known for her research in the fields of vascular biology and molecular cardiology. Professor נייבל joined the National Heart, Lung, and Blood Institute, NHLBI, of the NIH in '99 as the director of clinical research, and in 2005 she became the director of the NHLBI. As NHLBI director, Dr. נייבל envisioned and implemented an extensive national research portfolio to establish pioneering scientific programs in genomics, stem cells, and translational research, and others. An accomplished physician scientist in her own right, Dr. Niejbel's work on molecular genetics of cardiovascular disease has generated 17 patents and more than 250 scientific publications. Her memberships include the American Academy of Arts and Sciences, the National Academy of Medicine, among many others. She's currently on the TED Med Editorial Advisory Board, previously served on the editorial boards of the New England Journal of Medicine, Science Translational Medicine, and editor-in-chief of Scientific American Medicine. Her many honors include the Eindhoven Award from Leiden University, the Amgen Scientific Achievement Award, 2 Distinguished Achievement Awards, the Eugene Braunwald Academic Mentorship Award from the American Heart Association, the Distinguished Alumni Award from Weill Cornell, the Lewis Katz Research Prize in Cardiovascular Research from Columbia, the George Kober Medal, and many others. She's also received 6 honorary doctorates. Dr. נייבל has a long record of advocacy for health and broadening access to care. As director of the NHLBI from 2005 till her current position, נייבל leveraged the $3 billion research portfolio to establish pioneering scientific programs, as I mentioned, and was instrumental in establishing a national teaching hospital in Haiti, advancing training for clinicians and researchers in under-resourced regions of the world. One of her signature advocacy efforts was the Red Dress Heart Truth Campaign, which raises heart awareness in women through unprecedented industry partnerships. I can stand here and talk about Betsy for hours. There's so much more to say about this extraordinary woman, but as always, there are time limitations. So, dear Betsy, let me thank you for agreeing to participate in the 2018 Rambam Summit and to be such a central part of the 80th Rambam anniversary celebration. And advance congratulations to you and Gary and your family on your much anticipated 2018 Rambam Award. I'd like to welcome you up to the podium to speak about Back to the Future of Medicine.
Thank you very much, Carl, for the very kind introduction. Deputy Minister of Health, it's a great honor to have you attend this morning. Professor Rafi Bayer, it's my honor to be here with you today. Thank you for inviting me. And professors and presidents at the Technion, the University of Haifa, it's a great honor as well. So it's a great joy that I return. This is my third visit to Ramban, and to have an opportunity to meet with so many extraordinary scientists and physicians here at Ramban. So thank you very much. Professor Skorecki asked me to talk about Back to the Future of Medicine. And as I thought about the life sciences community that is growing here in Haifa and the life science community that's growing in Boston, there are many, many similarities. And so what I would like to do today is tell a story that really weaves together our two medical centers, because one of the themes that I want to address overarching is that we are a global medical and scientific community. That which unites us is far greater than that which divides us. And one of the very special aspects of medicine and science is that it crosses all geographic boundaries, it crosses all ethnic boundaries, and it is one element that ties humanity together. All right. So I know that I'm speaking both to scientists and to physicians as well as to lay people. So some of you may not understand, what do we mean by academic medicine? Academic medicine has 4 missions, and in this element, Ramban, and I will say the Brigham to represent my academic medical center, share a common history of commitment to academic medicine. First and foremost, we give outstanding patient care. The patient is first in everything we do. But in order to provide that exceptional care, we must have a foundation of innovative research. In addition, we must be committed to training the next generation of physician and scientist leaders who will go on and lead the research that will bring new therapies to our patients. And certainly we must serve our communities. Just as you serve your community of Israel, we serve our community in Boston. We also have a shared vision. If you look at our vision statements, they are very similar. Yours is to be a leader in medicine and make an impact in Israel and worldwide on treatment, innovation, research, technology, and team development, all while maintaining the centrality of the individual, whether patient or staff member, in every activity. I could take your vision statement and translate it to ours. Ours is shorter, but we really mean the same. Maintain and restore health through leadership of high quality, compassionate care, scientific discovery, and education. Now here's our history. Ramban, congratulations on your 80th anniversary, going back to 1938, which during the British Mandate, you established departments in internal medicine, surgery, OBGYN, and psychiatry. And I can say with great pride that my husband's uncle came to Haifa from Poland in 1938. He was a stowaway on an Italian boat. When they arrived in Haifa, the British would not let the boat in, and they created a mutiny, and they arrived in Haifa. And then as a young man, he was 18 years old. He traveled by foot down to Tel Aviv and has had a really marvelous life as a coach and teacher at the Wingate Institute, and is now 98.5 years old, will be 99 in September. And he's just been invited by the president to participate in a celebration of centennials in Israel. So a wonderful history. So we feel a very special tie to Haifa, but we have many cousins now in the Tel Aviv area. But you have an extraordinary history. You established the Myers Children's Hospital, and you now have had many firsts in the practice of medicine, including ablation of brain tissue in a patient with essential tremor, using MRI-guided ultrasound instead of surgery, and I saw such a treatment the last time I was here. And you also are the first installation site in the world for a hybrid nuclear imaging scanner. A wonderful, wonderful history. My history at my hospital began in 1913. We began as the Peter Bent Brigham Hospital. Peter Bent Brigham was an Irish immigrant who came to the United States, to Boston. He sold fish out of a wooden cart up and down the street. He died in 1980, and his will said he wanted his monies invested and in 25 years build a hospital to serve the immigrant poor of Boston, predominantly Irish and Italians at the time. But nonetheless, our hospital opened in 1913, and there were several dignitaries. Let's see if yes, I can point. This is Sir William Osler, the very famous Canadian physician who was a master of American medicine at Johns Hopkins. He came to bless our medicine department. This was our first chair of medicine, Dr. Henry Christian. This was Dr. John Warren. You can see the elders had their distinguished hats on. He was the chief of surgery at the Massachusetts General Hospital, and he came to bless our first chairman of surgery, Dr. Harvey Cushing, who went on to develop the field of neurosurgery at our hospital, doing the first craniotomy and brain surgeries. These were what we called the house officers. These are the young men who lived in the hospital and took care of the patients. And as you can see, the women were relegated to being the nurses. But I can tell you our hospital is now fully integrated with all genders, all races, and all ethnic diversities. This is Dr. Sidney Farber, who became the Dana-Farber Cancer Institute. Our cancer partner, Dr. Farber, created treatments for children's cancer. And so we have had a long affiliation with Harvard Medical School. Harvard Medical School was founded in 1782. It's the third medical school founded in the United States. In 1906, it moved to its current Longwood campus. And in the United States in 1910, there was a very famous report called the Flexner Report. Prior to that time, medical schools were trade schools. They simply, you paid your money and you got a piece of paper that said you could be a doctor. The Flexner Report said no, that medical schools should associate with teaching hospitals, and that teaching hospitals should teach medical students how to be physicians. And so the first teaching hospital in the United States was Johns Hopkins, and we were the second to be the first teaching hospital of Harvard Medical School. We are neighbors, back to back to each other. And in 1980, three hospitals came together. The Peter Bent Brigham Hospital, our original hospital, the Robert Breck Brigham, which was a hospital for orthopedics and rheumatology, and the Boston Lying-In Hospital, the first hospital for women and children in Boston, all came together, and we are now Boston Brigham Women's Hospital. Like you, we have had the good fortune of having three Nobel Prize winners. George Minot discovered the treatment for pernicious anemia, which is vitamin B12 deficiency. He found that by treating patients with iron, the soluble factor, treating patients with liver, in which the soluble factor is iron, he could cure anemia. Dr. Joseph Murray performed the first human organ transplantation in 1954. You can see the picture of his operation there. It was a transplantation of a kidney from one identical twin to another. And he received the Nobel Prize in 1990. And then Dr. Bernard Lown, a cardiologist, helped found International Physicians for the Prevention of Nuclear War, for which he received the Nobel Prize in 1985. Today, Brigham Health is a tertiary academic medical center. We consist of a physicians organization, community hospital, as well as the Dana-Farber Cancer Institute. And we are part of a much larger health system called Partners Health System. We and the Massachusetts General Hospital, another academic medical center in Boston, came together in 1994. We are the two academic centers. We have a specialty psychiatric hospital, a specialty eye and ear hospital, a specialty rehab hospital, and then we have a series of community hospitals, as well as we employ our physicians under the physician organizations as well. And we are the major teaching hospitals now of Harvard Medical School. For those of you who may not be familiar with medicine in the United States, we are currently undergoing a very significant change in how we are paid to conduct medicine. We have commercial insurance payers in the United States as well as our government. We are about 50-50 commercial to government. But at the Brigham per se, we are about 1,000 beds, about the same size as you, a large number of admissions, outpatient visits, and about $4 billion in clinical revenues, and about 18,000 employees. On the research side, we are very, very committed to research. We are one of the largest research hospitals in the United States, and we have about 1,000 principal investigators who solely conduct research. We and the Mass General have the largest research budgets of any hospitals in the United States, and like you, we are very focused on invention disclosures and publications, which I'll discuss in a moment. One of the metrics of our research success is funding that we receive from our National Institutes of Health, and highlighted in yellow are the hospitals, the partners hospitals, and our funding in fiscal year 17. And you can see that we and the Mass General each have about $400 million of research funding apiece, all combined between the Mass General and the Brigham. We're about $1.5 billion in research funding each year. So that is our history, our very rich history, and your very rich history. And now what I would like to focus on is what will really differentiate and sustain academic medical centers in the future. And my very strong belief is that we are founded on transformative innovation, and it is transformative innovation which is going to carry us long into the future. And so I'd like to discuss 5 aspects of innovation, tell you a bit about what we're doing in Boston in the United States, and I know that you have many similarities here in Haifa, and I will try to tie those together when I do so. So when we talk about innovation and discovery, I like to say that innovation and discovery are the foundation of everything that we do at the Brigham. We can't provide exceptional care to our patients unless we are continually innovating. And innovation transcends not just basic research, but clinical research, population-based research, health systems research, healthcare policy, as well as healthcare financing. And it is important to have scholars in each of these areas so that we have the full spectrum of innovation across the medical perspective. So let me start first with some of our basic and clinical work. In 2017, we had the good fortune of opening our Hale Building for Transformative Medicine. Like you, we are also dependent upon donors to provide support, and so the Hale family very kindly gave us a very generous donation for our building for transformative medicine. I think this building will be very similar to your Helmsley Tower, which you will have the groundbreaking tomorrow. So let me just tell you that underground, importantly, we have parking. Very important to have parking for our patients. And then underground, we also have several floors of imaging, and in addition, 2 very large boilers that generate the steam, chilled water, electricity, all of the utilities for the building as well. On the ground level, we have a small museum to an education center for our patients. And then this is the home for our neurosciences and our orthopedics and arthritis. They are the outpatient clinics, and we integrate the neurosciences across neurology, neurosurgery, and psychiatry so that all patients are seen by a team of physicians. Then we have a conference center and our Center for Experimental Therapeutics. We have a floor for our faculty offices. And then we have 7 floors of research, basic research, that then tie back to the clinical areas. This clinical research building we designed after our clinical research center at the NIH, and I can say that our physicians, our scientists, and our patients love it because our patients, after receiving their treatments, can be invited up to the research floors to try to understand what research is like. We have an innovation hub right in the Hale building, and I know that you have a very large innovation center. I believe it's the Mind Up, and I've had a chance to visit Mind Up. Our innovations are very, very similar. Our innovation center, we have decided to focus on digital health because we think that this is an opportunity which particularly our young entrepreneurs can really have a major impact in developing new digital approaches to healthcare which will impact our patients. And like you, we really provide this as an innovation hub so that we can capture the ideas of our students and our faculty through various types of programs. Then we develop relationships with engineers, entrepreneurs, designers, venture firms, angel investors. We enter the pipeline. We provide project management for our young entrepreneurs, and then we help them with commercialization, much as you were doing in Mind Up. One of the areas in which we are particularly focused is artificial intelligence. For those of you who may not be familiar with this field, artificial intelligence is the simulation of human intelligence by machines. And we are currently using artificial intelligence in many aspects of our daily life, but there's a new emphasis now on using it in the domain of medicine. And the Brigham and the MGH, we have formed our Center for Clinical Data Sciences, and this is being funded in large part by GE. It's a very strong partnership. And we're looking at two initial clinical areas to apply artificial intelligence. One in radiology and the other is in pathology. And let me give you an example in radiology. So as you can imagine, when you form a very large health system and network, as you have, a patient may come into the emergency room in an outlying hospital in the middle of the night, may have a chest x-ray, a CT, or an MRI, but there may not be the local expertise to read that study at the community outlying hospital. Using artificial intelligence, we can then use algorithms to pre-read the image and then have the pre-read and the diagnosis overread by a radiologist who may serve in a central radiology office that is on call or serving all of the peripheral community hospitals. In this way, we can provide an accurate diagnosis and provide the diagnosis in a very efficient manner without requiring radiologists in all the outlying hospitals. We intend to do the same in the area of pathology as well. That's in the early stages. So that's a bit about innovation and discovery. But let's talk about our life sciences ecosystem. And here I think we have great similarities between Haifa and Boston. Not only are we cities, you're on the sea and we're on the Charles River, but building the life sciences ecosystem has been a major focus for Boston over the past 20 to 30 years. So like you, we are very dependent upon the great strengths of two outstanding universities in Boston, Harvard, and MIT, Massachusetts Institute of Technology. And from the two universities, we formed the Broad Institute about, I want to say 15 years ago, that's focused on genomic technologies. And the Broad Institute, so capably led by Dr. Eric Lander, is now a resource for all students and faculty in the Boston area. Much innovation occurred around MIT in what's called the Kendall Square area of Boston, and now that is expanding into many other neighborhoods. But as a result, many of the large pharmaceutical companies in the United States now have research programs and offices in Boston. In addition, it's attracted a number of biotech companies, Amgen, Biogen, Genzyme, for example, and we have many large venture capital firms as well. And of course, the teaching hospitals, we are very devoted to ensuring that our trainees can participate in this very large ecosystem. And you can see you have your ecosystem here that mirrors this between your universities of Technion and the University of Haifa. Rambam is your great academic hospital, and then attracting in pharmaceutical industry, biotech, and venture capital. So one way this works is I'm going to tell you the story of my son, Chris נייבל, who is an MD, PhD student. He finished medical school in Pennsylvania and came to train. And this is how a young person can take advantage of our ecosystem. And I hope the same way a young person can take advantage of your ecosystem. Chris did his medical residency at Brigham and Women's Hospital. He then decided to be a cancer doctor and did his cancer training at the Dana-Farber as well as at the Massachusetts General Hospital. This summer, he will go to be a postdoctoral fellow at MIT at the Koch Institute studying cancer biology. And he will also do his research at the Broad Institute. And so as a student, he has been able to participate in all of the various resources that our life sciences ecosystem has to offer. And that's really the benefit of these ecosystems, is our young people, the next generation, who have all the talent and the bright ideas, can take advantage of so many experts in so many different domains. Research commercialization is critically important. I know it's very important to you. We have formed what's called Partners Innovation, which is the research commercialization arm of Partners. And you can see the various functions: business development, company creation, industry collaborations, innovation management, international consulting, licensing, research translation, strategy and funding, technology marketing, venture investing, workforce capital building for commercial collaborations. And Dr. Bayer and I talked about, are there ways in which Boston and Haifa can further collaborate together? And I think this is one of the areas, is by having our commercialization arms really work together as well. And so let me tell you a little bit more. Chris Colburn is our leader. And what Chris has done, this is a very complicated slide, so I don't expect you to read it all, but it's just to say that he has developed a very extensive organization based on domains within medicine: cancer, dermatology, anesthesia, radiology, surgery, cardiovascular and pulmonary, medicine and pediatrics, neuroscience, orthopedics, regenerative medicine, business development, and venture. And then he has sector leaders for each of these that he has recruited from the biotech and pharmaceutical industry. So he's brought in individuals who've done research commercialization in the past to lead these various sectors. He establishes goals for each of these various sectors and has been quite successful in achieving interest. In addition, we have a tech transfer office which is very aggressive in terms of pursuing patents and licensing of the technology. Since our formation, going back, I want to say now maybe 8 or 9 years, we've had a number of spin-offs. 215 spin-offs since founding, 120 of those in Massachusetts. Many in Massachusetts, the spin-offs in Massachusetts go on to be licensed to larger companies elsewhere. But it's been about 137 million of commercialization revenue. I think that this is really very, very important for us. Research commercialization is very important for you because it helps fund and fuel the research and education enterprises, and also helps sustain the excellence in patient care as well. A spirit of entrepreneurism, particularly in our trainees, and this was something that Dr. Beyer and I were talking about earlier. I think for Professor Skorecki and Professor Beyer and myself, our generation, we were trained to be physicians to stay within academic medicine, but we were not encouraged to develop these collaborations and partnerships. But it's a different world today, and it's absolutely essential, and I would say it's our responsibility to take our ideas and translate them into new knowledge and share them with the companies who are going to be able to develop them and commercialize them. So we are really encouraging our trainees to be entrepreneurs. And indeed, I told you the story about my son, and I keep saying, you know, as you go about doing your research, you have to think about the ways that you can partner with industry in Boston as well. So one of the ways in which we've done this is we have formed what we call the Translational Accelerator. At the Brigham, we have a unit through which Chris Colburn and his team can work that will attract pharma and biotech to come and do clinical trials with us as well as to partner with us. It's also a way that we can encourage our trainees to meet with industry leaders. We can form the bridge between academia and industry. I'm sure that you will do the same here at Ramban. Several of the fun things that we were doing early on in the United States in the 1960s and the 1970s, doctors did house calls. We've gotten away from that, but we have now formed a home hospital due to the great mind of Dr. David Levine. David now has a medical service where he goes out and does rounds on patients in the community every day along with nursing staff. So a patient who might need antibiotics for a pneumonia or a cellulitis, if they have adequate support at home, we put in a PICC line, a central line, and the doctor and the nurse come to the home once a day to infuse the antibiotics, and we have found a reduction in the cost of care, more efficient care, as well as great patient satisfaction. On another scale, Dr. Atul Gawande has formed Ariadne Labs. He's very interested in looking how he can take health delivery systems and scale them on a global basis. His parents are both physicians but had come from India. He still has a lot of family in India, and so Atul has spent a great deal of time in India helping them to develop checklists in their birthing hospitals and in their surgical hospitals and helping to scale up health systems, all part of being an entrepreneur. And finally, I would say that we are a global community and that science and medicine continue to unify rather than divide us. And that as our life science communities mature, we hope that the line or the connection between Boston and Haifa grows, and that as we focus on our communities of research development as the future of medicine, that we have more and more partnerships together. I have noted that there actually are quite a number of research deals between Massachusetts and Israeli-founded businesses. In fact, I was here this past December with our governor of Massachusetts, who led a business delegation here to Israel, and in particular it was focused on technology as well as the life sciences. And he came away with an a very positive, favorable impression of the life sciences community here in Israel, and is doing what he can to support connections between Massachusetts and Israel. So I think we can collectively be very proud of these companies, these businesses that are a connection between our two communities. So I'm going to summarize by saying, why am I so optimistic about our future? This is back to the future. 105 years ago, when the Peterbilt Brigham Hospital was founded, the top 3 causes of death were influenza, TB, and GI infections. And we had treatments of rest, diet, opium, and willow bark, as well as applying heat and cold. Pretty crude treatments. 80 years ago, when Ramband was founded, the top 3 causes of death were heart disease, cancer, and stroke. We've made great advances in all 3. But at the time, the major treatments were sulfa drugs, spinal anesthesia, ECT therapy, widespread use of vitamins and X-ray machines, and the iron lung was being developed to treat polio. And today, we have genomic sequencing for cancers and many other common diseases. We have the immunotherapies for cancer. We have extraordinary progress in cardiovascular disease with prevention modalities and devices, as well as many humanized monoclonal antibodies to treat autoimmune diseases. So much to be optimistic and hopeful about. So I would argue very vociferously that our goal today is no different than 105 and 80 years ago. It's really leadership of the academic medicine, that health centers like Ramband and like the Brigham are the genesis of the ideas, creation of the ideas that go on to be translated into new diagnostics and treatments that then allow us to make advances in exceptional care. We can't do it alone in academic medicine. We must partner with our partners in pharma, biotech, venture capital, and the universities if we're to realize this success. So on your 80th anniversary, I congratulate you on your extraordinary success as an academic medical center, and I wish you all the best for your next 80 years times 10 of great success. Thank you very much.